Hello, and thank you for allowing me to conduct this presentation. My name is Dr. Joshua Makary. Today I'll be presenting on the long-term outcomes of a male retro-urethral transobturator synthetic sling for treatment of post-prostatectomy incontinence, impact of radiotherapy, and storage dysfunction. There are no affiliations to disclose, and this was a self-funded project. The aim of this study was to determine the long-term durability of the advanced sling for post-prostatectomy incontinence and impact of prior radiotherapy and storage dysfunction. 80 men undergoing advanced sling insertion for post-prostatectomy incontinence during 2008 to 2013 were reviewed post-operatively at 3 years and 9 years. Pre-op urodynamics, pre- and post-op pad usage, prior radiotherapy, PGI scores, and decision regret were recorded. Mean follow-up was 111 months, or approximately 9 years at long-term follow-up. 8 men died between mid-term and long-term follow-up. 12 men had radiotherapy pre-op, 10 had detrusor overactivity, and 20 had reduced compliance. Pre-surgical mean 24-hour pad weight was 264 milligrams. Pre-op mean pads per day was 2.49. This decreased to 0.41 in the immediate post-surgical period. At midterm follow-up, this was slightly increased to 0.58, and at long-term follow-up, this again slightly increased to 1.04. At midterm follow-up, mean PGI score was 1.84, and at long-term follow-up was similar at 1.71. In long-term follow-up, 1 in 5 men cited their incontinence as their main health concern. 5 men went on to have an artificial urinary sphincter inserted. 1 man had a second transobturator sling procedure, and 1 a bulking agent procedure. Of the 7 men who had a subsequent incontinence procedure, 2 had a history of radiotherapy or detrusor overactivity. When asked about decision regret, 1 in 7 men regretted having the sling put in. A third of these men had a subsequent incontinence procedure. At midterm follow-up, PGI score for men without radiotherapy or detrusor overactivity was 1.42, and in the long term, 1.57. With radiotherapy or detrusor overactivity, PGI score at midterm was 4, and at long-term follow-up, 2.6. In calculating the long-term PGI score, men that underwent a repeat incontinence procedure were excluded from analysis. At midterm follow-up, pads per day usage for men without radiotherapy or detrusor overactivity was 0.27, and this increased to 0.77 at long-term follow-up, which is still improved compared to their pre-surgical pads per day usage. With radiotherapy or detrusor overactivity, at midterm follow-up, pads per day usage was 2.2, and in the long-term follow-up, 1.8. Again, in calculating the pads per day usage in long-term follow-up, men that underwent a repeat incontinence procedure were excluded from follow-up. In conclusion, the advanced sling provides long-term improvement in men with post-prostatectomy incontinence and remains a very valid management option in the well-selected individual. Men with radiotherapy or detrusor overactivity have significantly poorer outcomes. Pre-op urodynamics in men with radiotherapy and/or overactive bladder may be important when considering men for advanced sling. Thank you.